What I'd like to show you here is a game that was created in conjunction with a mechanism of action animation for an adhesion molecule inhibitor. This was shown at DDW in 2005, and the game is a flash game and was produced with the help of a partner that we have, Group DCA, and we had a presence at this booth for a lawn that contained this mechanism of action animation and also a game that the doctors could play to understand better the mechanism of action of this adhesion molecule inhibitor. So I'll begin by showing you, here's the splash screen. There was 6 pods, I believe, 6 screens set up with joysticks, and it's a highly popular game. At the show there was a leaderboard that showed who the current high scorers were. And I'm going to click on start, and you can see the game for yourself. So to introduce, the journey begins here with the doctor putting in their name. So I'm going to be Dr. Jim Bones for the purposes of the demonstration, and I'm an immunologist. And it asked me how many patients I currently treat monthly for Crohn's disease. I'm going to say 6 to 10. And all of this data is recorded. So it starts you off by telling a little bit about the story of Diapedesis and showing a clip from the movie that the mechanism of action that was created, showing Diapedesis occurring, talking about these integrin adhesion molecules that are important for the process of diapedesis, and showing the diapedesis occurring. Then if you click on next, continues and introduces these adhesion molecule inhibitors, which are the tools that you will use to stop this diapedesis from occurring in the game. So if we hit next, it's asking us if we want to practice. So it's explaining here the gameplay of this particular game, what the mission is: reduce the level of inflammation in chronically inflamed tissue in the gastrointestinal tract. So here we've got a blood vessel. We can steer this leukocyte with these integrin adhesion molecules on it, and we're trying to collect up these monoclonal antibodies, which are the adhesion molecule inhibitors. Once we get a full set of them, see it flashes, and we know that we're now immune from getting sucked down through into the wall of the blood vessel and causing inflammation. So without further ado, we'll start the game. We've got here 60 seconds to minimize diapedesis, and our progress is measured here on this inflammometer of how well we're able to stop inflammation from occurring by collecting these adhesion molecule inhibitors. So get ready, and here we have clips from the animation that played a key role in this in the game, and really all of the artwork as well is taken from the game or from the movie and put into this game. See, one just went through the wall, but essentially I'm steering these and colliding with blood vessel or blood cells, and it just makes it a little trickier. See, that one just got coated, so that was good. So I'm trying to steer myself into these, and at the same time trying not to get into this tricky bend over here. There we go. So the game was at first challenging for the doctors that would step up and start to play it, and then they caught on really fast and enjoyed playing this game and came back numerous times, many of them, to try to beat their scores. And really the key thing is they're playing with this mechanism of action. It's not just some arbitrary game. It's actually the mechanism of the drug that Elon is trying to educate them on, and I think they have a tendency to remember and recall something like this. And so you could just see the inflammation just turned the screen a little bit redder. So as these cells go through diapedesis, the surrounding tissue turns redder, and I guess the main goal. So I did okay. I was able to stop diapedesis, 57% reduction in tissue inflammation. So, and then I can put my high score up here because I did all right. And Dr. Bones is number one right now. So that's the game that goes with the movie. Hopefully, if you get a chance to watch the MOA, ideally the way that works is the MOA is watched first. In this particular case, around the outskirts of the booth, there were 4 screens playing the MOA. And then when the doctors go inside the booth, then there's 6 pods with these games, all playing, all linked together. And our main objective, of course, is to get them thinking about the mechanism of action and getting them understanding it and remembering it and making a good impression. So thanks for watching.